All right. Good afternoon, everyone. This is according to the CET again. I see that our number of attendees has more or less stabilized, but the webinar is open, so we will have a few latecomers. That's not a problem. I would like to just introduce myself again in case some of you have not joined us this morning. My name is Roman Tandlich. I'm the Regional Director of Teams in Africa. And I have the great pleasure to introduce our keynote speaker for this afternoon, who is Dr. Jeffrey Stern. Dr. Stern is the Superintendent of the Emergency Management Institute in Emmitsburg, Maryland. He previously led the Virginia Department of Emergency Management, where he was responsible for disasters, homeland security, preparedness, mitigation, response, recovery, and efforts across the Commonwealth of Virginia. In 2014, he was appointed by Governor Terry McAuliffe to lead Virginia through the nearly 50 emergency declarations over 6 years, and was deployed to the Virginia first responders to disasters across the United States. Dr. Stern is also chaired the Virginia 911 board and oversaw the Commonwealth's Homeland Security and Emergency Management grant programs. He further served for more than 3 decades as emergency manager, first responder, agency executive, and an advisor. Over the course of Dr. Stern's career, he has served in local, state, and federal government positions across the private sector and in academia. He was also appointed as the White House Fellow in the Department of Interior and the Department and to the White House Homeland Security Council. He served as an executive director of the Homeland Security Advisory Council, the advisory board to the Secretary of Homeland Security, and further positions. He currently also serves on several other advisory and policy boards, including the FEMA National Advisory Council, where he has chaired the Response and Recovery Committee for FEMA 2040. He's also linked to the United States Department of Commerce's FirstNet Public Safety Advisory Committees across the United States government. Dr. Stern has graduated from the College of William and Mary with a Bachelor of Arts in Government, American University School of Public Affairs with a Master's in Public Administration, and then finally with a PhD from the Virginia Tech Center for Public Administration and Policy. With the introductions complete, I turn the floor over to Dr. Stern for his presentation. Thank you.
Thank you so much for that introduction, Roman, and I'll have the chat open out of the corner of my eye, but don't hesitate. I'll ask my fellow panelists to speak up if there's any challenges with the audio or the connection. It's so good to be with you all today I'm located in Arlington, Virginia right now, just outside of Washington, D.C. It is 8 in the morning here on the East Coast of the United States. So I give greetings to you wherever you are in the world. And I appreciate Harold helping me last night coordinate the relationship to time, Oslo time, as I tried to navigate the synchronizing the schedules. Roman gave a very long introduction about how I teasingly couldn't keep a job. But I've had a very eclectic career that has involved service as a first responder and as an emergency manager and as a government executive at the local, state, and federal level in the United States. And I've also, in addition to having government roles, have taught for 8 years at Georgetown University. So I sort of think I blend a combination of practical experience, policy making, and academics that I've taken for granted, but it's probably somewhat unique and gives me a little bit of insight into how our system plays together. I'm going to talk about how we're reshaping professional development for emergency management, and I think our role in this sort of perpetual suite of crises. And I understand I've got about 20 minutes with you, 20 or so minutes with you all today. But first, I want to put that in context, since we have a global audience, of the emergency management system in the United States and how it differs from the global system. A little bit about the Federal Emergency Management Agency and its role in the United States. Certainly about EMI, the Emergency Management Institute, called EMI, which I refer to it as EMI. I was in Mexico City with our Mexican counterparts just a few weeks ago, and they're opening up their physical building. They're beginning to build their version of an Emergency Management Institute, and they kept referring to us as EMI. It took me a little while to understand. It actually sounded a little more elegant saying EMI than EMI. I want to talk about some changes, in our professional development, our emerging profession, whether you're a practitioner, whether you're an educator, whether you're a researcher, or whether you're a policymaker. And again, this context with climate change, climate adaptation, health crises, and the various socioeconomic and political crises that we have. So, and I'm happy. So the U.S. system, and forgive me if some of you are familiar with it, but I do see we have a global audience. The United States government system is a constitutional, what we call a federalism system. So there are distinct differences between the national government, what we call the federal government for the United States, and our 50 state governments. And inclusive with the 50 state governments are our territories, like Puerto Rico, as an example, and I think we're over now 500 tribal nations, which have direct access to the federal government. So it's in public administration, we call this sort of a layer cake model, and there are different lines of authority at each level. And when it comes to crisis management, especially for natural disasters, the United States Constitution has sort of two clauses that really give the power and authority, not at the national, not at the federal level, but to the state level, to the governors to manage crises. The first being in the preamble to the Constitution, something known as the General Welfare Clause, and the second being what we call our 10th Amendment. The important thing about that, without getting into a legal history, is there's been a long history of the United States of disasters being local. And we say that, similar to politics, all disasters are local. They begin locally, they might expand, but they end up ending locally. And it's only in about the last 70 years that really the last 50 years, that the national government's become more involved in disaster response and in supporting the state and localities because of both politics and the increasing number of disasters. Now, the federal national government has always been responsible for national security, to the extent that, as we'll discuss, national security, at least what we refer to it in the United States, more of your geostrategic global security around the world, that has now blended for all of us with our domestic or homeland security and emergency management. As the world has become more complicated, I think further challenges us as a profession in developing our roles. The takeaway is there are distinct differences between our national government's role in disasters and the state and local governments. In each 50 states, the relationship between the state governor and the local mayor or county official is different based on that state's constitution. We truly are an amalgamation of very different laws and policies. And so if we think back to sort of the seminal recent example from 16 years ago in Hurricane Katrina, everybody sort of recalls the failure of the national government to respond, but that was built on a systematic failure of every one of those layers, a failure of the mayor and the city in New Orleans to effectively be prepared and to coordinate their response, a failure of the exchange and relationship between the mayor and the governor in Louisiana, Governor Blanco at the time, who sadly passed away this year, and then a failure of the federal government at the time to intercede when those lower levels of government had failed. And that was very much at the time, and up to 2005, the operating strategy, philosophy, and doctrine in the United States was we would have a tiered system where we would wait for if you're a local government, all disasters start locally, you would wait for those resources, that government to call for help, then the state government or other local governments would come to their aid. And it wasn't until the state government and that was calling for help and was overseen that the the federal government would come in. And what we found and changed as far as doctrine afterwards was those subsequent layers, the state level and the federal level. If you have the chance for something like a hurricane where you're seeing it coming, to prepare ahead of time, or a storm, that you need to put those resources and those relationships and the teams together ahead of time. So we changed our operating doctrine in the United States after that. But our system, our Constitution hasn't changed. And so that's important to understand. Now, in the United States, through our history, as I said, the federal government has only more recently in the last several decades taken on an increasing role. And FEMA, the Federal Emergency Management Agency, is a relatively actually young federal agency. It's only about 40 years old. We were created in 1979 at the very end of President Carter's administration. And it was sort of an outcome of a shift of sort of the end of the beginnings of the end of the Cold War, and what in the United States we refer to as sort of our civil defense era that ran from World War II to that period when we were preparing for an atomic or nuclear exchange with the great powers between mainly between the Soviet Union and the United States. And so there was sort of this what we refer to as civil defense idea that we would help prepare citizens in the states and local and even the federal government for the aftermath of a nuclear attack. That subsided in the 1970s with the creation of what we now call in our profession referred to as all hazards emergency management, and the idea that we shouldn't just have civil defense resources, but we should have resources that could respond to a wide variety of natural and technological disasters. And in the United States, there were many events in the 1960s and 70s that sort of led to this. Some of the environmental degradation, the creation in the United States of the Environmental Protection Agency, and then again, FEMA in 1979. And right on the tail end of, at the time in Pennsylvania, in the United States, something we refer to as 3 Mile Island, the incident at a nuclear power station. That was drew a lot of attention about the challenges around nuclear power now. And so FEMA's role, and after 9/11, FEMA was an independent agency, and then after 9/11 was absorbed into the newly created U.S. Department of Homeland Security, which has also a wide variety of border security and other agencies. So the Department of Homeland Security consists of FEMA, the United States Coast Guard, the United States Customs and Border Protection, the United States Citizen and Immigration Services, the United States Secret Service that protects the President of the United States and has some other missions. There's a few other agencies, our newly created Cybersecurity and Infrastructure Security Agency. And so the idea is there's an all-encompassing border security and safety sort of protection. There's a lot of debate in the United States in the field, at least the emergency management profession, as to whether FEMA belongs in that group or not, but that's for the policymakers to make, and I don't see that changing anytime soon. The Emergency Management Institute, the organization that I lead, and I was privileged to come aboard and join FEMA about 16 months ago as the superintendent. Previously, I had led as Roman said, the Virginia state level emergency management agency, working for 2 governors there. And so when I had the opportunity, and I'm a non-political position, so I'm a career civil servant role. I haven't been in political positions before. The Emergency Management Institute, we are actually 70 years old. This year we're celebrating our Platinum Jubilee. For those of you who are from the UK, I sort of think the Queen has stolen that from us for next year for her 70th anniversary. But we were founded originally in 1951 by President Eisenhower at the beginning of the Cold War to carry out that civil defense mission. Our name at the time and our function actually was in 1951 as the United States National Civil Defense Staff and Command College. So we were part of, in the United States, what we consider sort of the national security professional development institutions, like our National War College, our National Defense University, our Naval Postgraduate School, our military colleges. And in fact, I sit on a sort of consortium in the United States, what we call a National Security Education Consortium. And my peer superintendents are the superintendent of the United States Naval Academy, the United States Military Academy, what we call West Point, and the presidents of those other war colleges. And we're sort of going through a process of trying to reinvigorate how we prepare our national security professionals, and the emergency managers now are back at that table where we were. So we were at the beginning of the Cold War, and then I think in the 1970s and 80s when we created All Hazards Emergency Management, we sort of separated, in the U.S. at least, I thought about ourselves separate as civil government, separate from the national security apparatus. And now with the complexities, we've sort of come back. Now, EMI, last year we had 934,000 students take 2.5 million courses, mostly online. We have a 361 course class curriculum. Many of our classes are available for college credit at partner universities. There are 327 universities in the United States that provide emergency management associates, bachelor's, master's, and a couple of PhD programs, and some of those universities accept our programs for credit. It is very important to distinguish that 211 of those classes, and the majority of that 900,000, are online. But we do have 150 classes that we offer in person, both in our campus in Emmitsburg, Maryland, which is just south of Gettysburg, Pennsylvania, where the infamous Civil War battle was fought in the United States. And then we do what we call mobile deliveries around the United States, where we probably provide in-person training to about 10,000 other students. And we've really been thinking through and trying to reframe it since I came in. Are we currently serving the needs of those 900,000 students, of the emergency management professionals? And there are folks from around the world. You can take classes for free, especially the online classes. And so are we meeting the needs given the changing operating sort of environment for emergency management? I think when we look at the challenges of the pandemic and what that has revealed about our global readiness for a healthcare crisis, and we're in the middle of one. Sadly, we're approaching 800,000 fatalities in the United States. When we look at climate change and the impact of climate and the need to do both climate adaptation and hazard mitigation more effectively, when we look at, especially important in the United States now, the challenges of inequity in disaster outcomes and socioeconomic vulnerability. And we have I think, an unintended policy outcome in the United States, at least, where our disaster aid is actually exacerbating the socioeconomic vulnerability. The poor are getting poorer. It's harder for them to access aid, while the people that have more means are able to access that aid and are better off. And then obviously the political environment around the world, that our role as crisis managers has never been more challenging. And so therefore our role as trainers and educators in that system is even more pressing to prepare that current workforce. And not just the emergency management workforce, but looking at non-traditional audiences, other government employees, the private sector, NGOs, non-profit organizations, non-governmental organizations, even individual citizens in our nations. For about the last 10 years, we've used the term the whole community that we need to prepare in the United States. At EMI, our role has mainly been focused 95% on the emergency management community, and I think we need to pay a more increasing attention to what I'm terming the rest of the community, those other folks. And so we're setting off and reshaping what we hope to be a ambitious transformation agenda over the next year or two. And we've sort of set out a plan that I refer to as EMI Anywhere, and we've briefed this and have the support of the new FEMA administrator, Deanne Creswell, as one of her initiatives to roll this out. We're hoping to get some additional funding, but the idea behind it, we're calling it EMI Anywhere. And for any of you that fight in budgets, and the infamous or very famous American General Colin Powell, Secretary of State, who just passed away, Had the chance to meet him one time years ago, and he would say in Washington, D.C., the amateurs fight over policy and the professionals fight over the budget. And so we're hoping to have some budget initiatives fight over that support EMI anywhere. But the idea is that our programs need to be available to any emergency manager anywhere they are in sort of any platform. There are many emergency managers in the United States who can't get to Emmitsburg, Maryland for those 150 in-person training programs. And so our initiatives consist to push these reforms of, first and foremost, modernizing our e-campus operations, the sort of how we're going to deliver the programs. Secondly, to build satellite campuses around the United States in partnership with other federal agencies and our 10 FEMA regions, so that courses in person can be more accessible, because it's important to have both the online and in-person training. Third, we're going to be revising that 360 course curriculum to streamline it, to make it more accessible for new people coming into our field as to where they start in their careers, and for the experienced professionals to figure out how to specialize in tracks. And that's really where we're going to address, I think, climate change, climate adaptation, health, and some of these other issues, because there's a whole suite of knowledge gaps in our profession that we've identified. If we're going to effectively deal with climate adaptation, we have got to teach our state and local emergency managers what that means for them. In the United States, many emergency management agencies are only 1 or 2 people. So it's one thing to tell them, hey, you need to prepare for the climate. It's another thing to teach them how they do that, how they change their policies at the local level. Similarly, with economic and socioeconomic vulnerability, disaster logistics and supply chain management is a huge issue we've identified. Just simply handling in the United States the disaster financing and grants management for all our different disaster aid is another area in the U.S. disaster law and policy. And using data analytics across the entire cycle of mitigation, preparedness, response, and recovery. So we've identified this suite of things that we need to have in a revised curriculum. We're going to begin training, fourthly, some of our crisis leaders at the federal, state, local, private, nonprofit, tribal, and territorial level, putting them together in a network, running cohorts and trying to educate them in some crisis leadership theory, so that we can then help them build a network amongst each other. We expect this system to work, but we never bring these executives together at the different layers of government and from that private sector. And so we're going to consciously try to build that network and educate them. The last thing we're going to do is we hope to act as a catalyst for thought leadership to bring the policymakers, the practitioners, the academic educators, and the research together to drive our laws, strategy, and policy. So that's how we see fulfilling our role in modernizing this 70-year-old institution that for 40 years has sort of been doing this technical emergency management training to deal with that environment. So I'm looking at the QA now as we wrap up. And Roman, I'm happy if you want to navigate me to any questions anybody has, but it's been a great honor to join you.
That was a really excellent presentation. I have definitely gotten a lot more comprehension about how the US system of emergency management works. What is also very encouraging is the integrative nature of the curriculum updates that you're doing, especially the data analytics will be very important, especially with the recent experiences we've had in the Southern African region with the new variants that pop up. And the one of the major issues currently is tracking excess deaths, and the data analytics in our place becomes very important. And also what has become very, very clear is that we need to find a way to bridge the gaps between emergency management, disaster management, and healthcare professionals, which is still proving a challenge. Okay, so I see that the QA box is empty, but there's a comment from Arthur Rabjohn. EMI online program is second to none in my experience, and I want to thank EMI for making it available to non-US citizens through arrangements with the International Association with Emergency Managers. Thank you. So I don't know if you want to comment on that, Dr. Stern.
Yeah, so our courses are available. In fact, about 25 of our classes are now available in Spanish language. We have partnerships with several nations. I do think there's a need to build relationships with other similar international training institutions in other countries. I think that's a sort of next level that we need to drive towards. And we have a great relationship with the International Association of Emergency Managers, building a relationship here with TEAMS, the National Emergency Management Association in the United States. And so we love to make our programs available.
Thank you. Next question or comment is from Lamar Medlock. Absolutely agree with the previous comment. As FEMA employee and as an EM trainer, I can tell you that the EMI curriculums are outstanding. Great presentation. Thank you, Jeff. Okay, going further down, Larry Porta made a comment about the link for the training resources at FEMA are shared. Also, hold your cursor over. There are some instructions about how to access. There's a thank you note from Christian Somat. Great to be here and chat. And then there are further links. I think we had a raised hand from the team's president, Harald Drager. So maybe we should pass on the mic on to him.
Thank you, Roman, and thank you, Jeff, for giving us that overview of FEMA. I think that we needed to know that. And I just noted what Roman put up. And I have often, when I've been traveling, been asked, we don't have many training courses. How do we get them available? So what I would like after this to start a dialogue with you and see how can we also share these training courses with members and our network. I think that would be excellent if it's possible.
Thank you very much. Dr. Stern, I would like to thank you very much for taking the time in your keynote. All the best, and we hope to be in contact with you soon, according to what Harald just indicated. Ladies and gentlemen, thank you for joining us. We will further continue with the next talk in the program, which is entitled Emergency Decision Support System Platform, eCitizens Project. It is authored by Professor Snjezana and Professor Martina Baucic. Our today's speaker will be Professor Baucic, who is an assistant professor at the Department of Geodesy and Geoinformatics of the Faculty of Civil Engineering, Architecture and Geodesy at the University of Split in Croatia. Her areas of interest and professional research and academic endeavors include geomatics, GIS, spatial analysis, emergency management, environmental information, and web mapping. Professor Baucic has extensively published in the areas of academic and practical applications of these topics in the field of emergency management. And with that, I pass the floor on to you.
Thank you very much, Roman. So let me start. So I'm going to present the result of the European Community Project, CITIJENS. It is about building an emergency decision support system platform. So I will tell a little bit about the project, about the functionalities of the platform, and particularly about the social media component, which is included in the platform, and a little bit more details about the semantic analysis of the social media posts. So just as the previous speaker was mentioning at the end of the keynote speech, this European Community projects having in the focus combination of the different participants. So all these projects must include not only developers, not only civil protections agencies, but also the researchers, the community, and all the actors involved in the emergency and disaster management. So idea of this project is to put all them together and to improve the field of the domain of the project. So that's how this CITIJENS project included all these actors in development of this decision support system platform. So idea was to try to incorporate social media posts for the civil protection practitioners on a way that the system is selecting, searching the data, defining the scores for the social media posts, and displaying in the common operational picture so that the decision making in emergency management could use this information. Of course, we know that it's very important that informations are reliable and that we can trust to those informations. So this platform included one communication channel which enables us to read relevant social media posts in almost real time. So as you can see here, the partners and projects coming from the civil protection and emergency management practitioners, from the local communities and from the researchers. There are two universities included, University of Split and University of Bologna. It is project, cross-border project, Italy, Croatia. Value is almost 3 million euros. So project will end summer 2022, and I will show you the results till now. Regarding the main functions of the platform, so the main user interface, the main part of the user interface is a map. On a map, all the data is integrated. It means that all the data is geolocated, but you can search also through the data which is not geolocated. So the main sources of data are institutional data, different webcam systems which a certain area can have on a disposal, and the special type of data here on which I will focus is actually social media posts. Four different hazards are till now elaborated through this platform. It is a flooding, fire, earthquake, and health crisis. Also, there are some risk scenarios which could be incorporated in that platform as additional info. So the practitioners could search data by different criteria, by type of the source, by the event, by the date, by the relevance. And for each chunk of data, the practitioner could look into the details and could look to the geolocation, just as an illustration of how the platform looks like. Important is that that platform allows user to configure different things to accommodate to their needs, to their most often risks or hazards events they are responding. Also to configure different type of search, etc. So it is open, it is not hard locked. Many things are open for the users so they can parameterize the platform and the functions. Also, one interesting function which platform includes is event detection. So the platform is, you can configure the platform on a way that platform continuously collects data according to criteria the user set up during configuration, and try to recognize if some, for example, social posts could be related to one emergency event. So the platform has a function of identification of potential emergency events and grouping data coming from different sources to one event. And then the user of the platform can look to these potential events and finally classify them if they're really events or it's just maybe by coincidence some data looks like potential new emergency events. So that's one interesting function of the platform. If we look to the main architecture of the platform, we have three components. We have crawler, that's the part which continuously collects data from different data sources. So the user can define data source which will be used, and this specific data source is social media. The core module is collecting this data, analyzing, aggregating data, and populating the main user interface dashboard, which is exposed to the clients. There is additional module, decision maker, which perform semantic analysis of the posts and which assign different scores on the social media posts regarding to the relevance, potential relevance for the practitioners. I already explained that. So what is innovative in this platform is this how to say trial to incorporate social media data into operational picture. So there are some specifics that this platform include these semantic engines for analysis of the social media posts. Also that the data is geolocated and that the user can define certain things. For example, the user can say, I'm interested in the events related to fire. Then what is the alert level? The user can define geographic area in which he is interested in, start, date, time, and also keywords, hashtags, based on which the platform will make search over different data sources. So this is nice because the client can define these things which are in that moment of client interest. Looking from the maybe more looking what the citizens are doing, actually citizens are not doing anything special. They are doing what they usually do. It means that they are taking photos, they are writing messages and posting to the social media, and then the platform is performing a search over the data on social media databases, selecting the posts and merging with other sources of data, and finally displaying the data, relevant data, accordingly to certain algorithms to the users. Of course, how the platform can automatically define what is the relevant, well, what is really relevant for the civil protection people. So there is an issue of semantic heterogeneity because this platform should work on Italian, Croatian, and English language. So the language itself includes that the same term we cannot easily translate. We must think about the concepts which are behind the terms used in posts. Also, we have different operations which can have their own terminologies. Also, the risk, because here we are covering 3 and later we added this health issue as the 4th one. And also different data sources are using different terminology, and all of these different domains are bringing semantic heterogeneity into the problem, what is still unsolved problem in all the systems, including artificial intelligence supported systems. So here it's very simple solution. I cannot say solution, but certain level of solution for that problem is made based on the fixed Zora and scoring system. So each term is getting certain score. Term from the social media post is getting certain score from 0 to 1 up to its relevance for the risk we are looking for. Is it a flood? Is it an earthquake or something else? So, for example, if there is word danger in a post, it's in Italian pericolo, in Croatian opasnost, that term will get score 111 in all 3 types of hazard regarding the flood, forest fire, and earthquake. If the term is fire, it will get 0 score in regarding floods. It will get 0.25 for forest fire and 0 for earthquake. So based on these scores given to each term, the total score of a post is calculated. So the posts are firstly pre-selected by the properties given by the user, like if they are in certain geographic area, if they include already defined terms of the interest, if they cover a certain type of hazard, etc. And secondly, the pre-selected posts are evaluated by the calculating total score, and also by some other things, like if they include some media, some photo or video. If they're including some media, they are getting higher priority. And also if they include these project-specific hashtags, more than one, so they will be sorted like that in a dashboard for the practitioner. So for them, the selection and search over social media is supported by the platform. The civil protection practitioner will get the first social media post will be selected from the system by those criteria. So how it works right now? So during the project, together we built the Tesora of the terms, and we assigned the scores. And now this fixed Tesora is used by the software to score social media posts. What we see in the future, that this way of searching will be extended by certain use of artificial intelligence, which will search and try to upgrade this Tesora with the new terms appearing in social media databases. So that's all from my side. I hope that my tone was good.
Thank you very much for the presentation. You kept time perfectly. I would like to maybe start by asking, do you have from the data that you have collected so far, does the accuracy of the system vary with the language as I believe, according to what I saw, you originally intended, or does it matter according to, does the platform have different efficiencies for English, Croatian, and the other languages?
Of course, because unfortunately Croatian has a declination even of nouns. So there is a problem of all the forms of the same term. But this could be solved. Actually, it is just up to the richness of our Tesora. So Tesora for Croatian language must be more complex and populated with more stuff. What is nice that the software code does not depend on that. It is stored in a separate database, and it's now up to the population of this database. Idea is that this database will be populated also automatically, but in that case, it should be some human approval of that automatic population, particularly in the field of emergency management, where everything must be, particular information must be validated. So this is actually unsolved problem till now. There is no artificial intelligence which can really process and replace decision makers.
Okay, thank you. We have a comment in the chat box from Lamar Medlock. Professor Baucic, this was excellent presentation. I hope to share this with my colleagues who use crowdsourcing for emergency response, situational awareness, especially the integration of different languages. Thank you for the presentation. Then we have a question from Professor Menon. Dear Professor Baucic, can the system address disaster typologies other than floods, forest, fires, and earthquakes? And the second part of the question, can satellite imagery inputs be accessed for any sudden onset disaster incidents?
So the platform is open to fill with any source of data. So any satellite images, if they are exposed to some open protocol on some server where they are collected, they could be incorporated in a platform. It is just up to the richness of the Tezora. So all the software functions are the same, just we are now manually building Tezora for this semantic scoring of the terms. So all functions are the same. It doesn't matter which hazard, which event is processed.
Thank you very much. We will leave the questions there. Professor Baucic, thank you very much for your presentation. We will move on. Bye-bye. We will move on to our next presenter. So our next speaker today is Shayla Clarke, who's got extensive experience working in disaster recovery in the Nassau County in the state of New York. Shayla has experience in being involved in overseeing financial recovery operations during various natural disasters, such as Hurricane Sandy, Hurricane Irene, Tropical Storm Isaias, remnants of the IDA project, and so on. Currently, Shayla is affiliated as the Training and Administration Officer with the Theodore Roosevelt Division of the United States Naval Sea Cadet Corps. And Shayla has recently, in 2019, completed her master in the emergency management degree at Adelphi University. And with that, Shayla, the floor is yours.
Thank you for the introduction, Roman. Good morning or afternoon, whatever time frame you guys are tuning in from. For me, like Dr. Stern said, it is about 8 o'clock in the morning, so it is fairly early, but I am very excited and both honored to be here with you all this morning. So diving right into it, the vulnerable population is defined as populations whose members may have additional needs before, during, and after an incident in functional areas, including but not limited to maintaining independence, communication, transportation, supervision, and medical care. Individuals in need of additional response assistance may include those who have disabilities, who live in institutionalized settings, who are elderly, who are children, who are from diverse cultures, who have limited English proficiency or are non-English speaking, or are transportation disadvantaged, as per FEMA. By researching the relationship between the impacts of disasters and the communities, it became evident that vulnerable populations are more likely to suffer disproportionate consequences in times of disasters. And as a preventative measure, the needs of all vulnerable communities must be addressed during pre-event planning. During yesterday's closing remarks, a statement was made to the effect of, when we know what our neighbors are doing, we are more stronger and we are better. And the key is working cohesively as a community to bridge the gap of communication, to allow for the resources to easily flow between government representatives, first responders, and the communities to help increase survival and preparedness among all. The definition of accessibility is the design, construction, development, and maintenance of facilities, information, and communication technology, programs and services so that all people, including people with disabilities, can fully and independently use them. The definition of underserved communities is populations sharing a particular characteristic as well as geographic communities who have been systemically denied a full opportunity to participate in aspects of economic and social and civic life, as per Executive Order number 1435 that was released this year, 2021. FEMA's whole community approach is defined as, it explains that preparedness is a shared responsibility, and it calls for the involvement of everyone, all the way down to the individual level. not just the government, in preparedness efforts. By working together, everyone can help keep the nation safe from harm, keeping it resilient when struck by hazards. The responsibility of preparedness for disasters begins on the individual level and builds up to the larger responsibility of the community and the local government. Community planning efforts are supported by voluntary organizations, faith-based organizations, community organizations, local, state, and federal government, much to what Dr. Stern of FEMA was alluding to earlier. Partnering with key stakeholders will increase, again, ease of access, dissemination of information throughout all phases of the disaster cycle, and which again is essential for one's preparedness needs. Emphasizing that preparedness begins on the individual level, it is up to us to empower those individuals to have access to the information, create their preparedness kits, and know where to get this information. FEMA explains the benefits of the whole community approach as understanding of risks, needs, capabilities, and increased empowerment of the community members, therefore improving resiliency nationwide. So according to the New York State English Second Language Achievement Test, New York State in 2016-2017 was a linguistically diverse state with about 200 languages spoken in New York State alone. This exam assesses all English language learners and their proficiency of their language proficiency spoken from kindergarten through 12th grade. For the academic year of 2016 and 2017, the top English language learning districts in the state collectively have over 201,000 English language learners. This chart on this screen shows the top English language learners that make up those 201,000 learners. Of those, two of those are within Suffolk County, New York, where I was born and raised. And those are Central Islip, which has 2,498, and Brentwood, which has 7,010. Brentwood and Central Islip. And those two locations are right next to each other, making up a total of 10.8% of the county's population collectively. The assessment exposed that 22.7% of Suffolk County's population reported they speak a language other than English in their home. 51.4% of the population within Central Islip reported speaking another language in their home other than English. Meanwhile, 70.8% of Brentwood's population reported speaking another language in their home to the US Census Bureau in 2018. Again, this table shows the top languages spoken in these English language learners. So this chart shows that Spanish was overwhelmingly reported at 64.5%. Chinese was reported at 9.2%. Arabic was spoken at 5.6%. And other languages was either 3% or lower. According to the US Census Bureau, Suffolk County's total population was 1.49 million people. And as of July 1st, 2018, 19.5% of Suffolk County's population reported as Hispanic or Latino. So after I gathered all of this information, I began to research where I was going out into the community. And going back to what I mentioned before, I knew I had to go to food pantries, faith-based organizations, nonprofit organizations, local community resources that these members of the community would be going to. So in about 2 to 3 months, I was able to find 41 food pantries, faith-based organizations, nonprofit community organizations. In about 16 hours, I called every single one of them that I could find a phone number for, tried to coordinate and set a schedule for when I could come there, bring packets that I had put together, and I did just that. So of the 41 sites that I had identified and either made contact with or not, I distributed 158 of the 200 packets that I created. As you can see on this table here, 46 packets were in English and 112 were in Spanish. This is a sample of the table that I put together when I was collecting the information of these locations. I notated what town the location was in, the type of facility, whether it was a camp, a library, a house of worship, a food pantry, a soup kitchen, the days of the week that they operated, because not all of them were open every day of the week. Some of them were open the first and the third day of the week. Some of them were open a certain times of the day. So it was really important to have all this information very organized. Some of them had phone numbers, some of them didn't, some of the numbers weren't working, some of them were, some of them had points of contact. So having this information very organized became very crucial. I still went to the locations that I did not get in contact with anyone with, just because it was still important to try and make those connections and garner those relationships with these community members. But at least the attempt was made to try and establish the connection before showing up. This is just the map of all of the sites that I went to. Right here is Brentwood, and right here is Central Islip. So you can see that these two towns are right next to each other, and the sites really are right. They almost overlap with one another. So my recommendations for next time, and if I were to do this project again in a more professional role, would be to take into account the whole community approach, which is the first 6 bullets. Understanding the community complexities, recognizing community capabilities and needs, foster relationships with community leaders, which I started doing, build and maintain relationships, empower local action, and leverage strength, social infrastructure, and networks and assets. Again, other recommendations I would take into account are establishing the needs of the community beyond the ones that I already identified, develop a strategic plan, develop a team, because that's something that I was lacking in this project. It was just myself. Train that team, execute the plan, review the lessons learned, and create an implementation plan. Although the outreach that I conducted in 2019 in both Central Islip and Brentwood was successful in getting preparedness packets into the hands of the vital community members, no follow-up was performed. And so the pilot approach, there's no results, therefore I can't test the validity of this project. So that's why if I were to do this again in a professional manner, I would follow these steps. And for my conclusion, I would like to read a quote from former FEMA Administrator Craig Fugate, who said, "Government can and will continue to serve disaster survivors. However, we fully recognize that a government-centric approach to disaster management will not be enough to meet the challenges posed by a catastrophic incident. That is why we must fully engage our entire societal capacity. Direct coordination between the government and the community it serves is essential, and planning for emergencies must include these critical stakeholders and members of the communities to allow for bidirectional communication, therefore addressing any potential unmet needs before a disaster hits. As indicated before, based on the research conducted in 2019, Suffolk County, New York had a high level of limited English proficiency population. And of the 200 languages spoken, Spanish was the highest in both Brentwood and Central Islip. Again, during emergencies, vulnerable populations have specific needs that have to be met prior to the incident happening."
Shayla, thank you very much. That was a really informative and really well executed project that you reported on. We are running quite a bit ahead of time, so thank you very much for sticking to the time limit and also making everything very to the point. We've got a question from Professor Menon, which goes something like this. When was this project carried out in Brentwood and in Central Islip? And then question 2, how many people were reached out by you for sharing the information?
I did this project in 2019, and I reached 34 different locations. How many individuals were reached of those locations, I don't know, unfortunately.
Okay. Is maybe let me follow up on that. Do you have any idea about the average household size? How many members are in a household in the study area?
I don't, but the U.S. Census Bureau might. So it's something that I could back into if I try.
Okay, all right. Thank you. Professor Menon, does that answer your question?
Yes, thank you very much. I think this is really remarkable that an individual could reach out to 34 locations and reach out to the community. It's really remarkable, and I think we should learn from this. Thank you.
In the meantime, I would like to just echo what Professor Menon actually said, because this is in a place where I'm at in South Africa, this is a really important part of the research that we do, especially in our case, it was in the prior to COVID, specifically, it was in the context of healthcare. And the point being that it is not just about access to information in your language, but also taking into account literacy problems. In our case, the literacy levels are not always as high as in the developed world. And the other thing that I would like to just point out is I really like the idea that you said that there should be a follow-up project, because I have seen definitely during, and I'm pretty sure that I'm not alone in this, is that during the COVID-19 pandemic, the lack of literacy in the main language of a country actually led to creation of parallel communication sources such as WhatsApp and so on, social networks that are very difficult to track, and this has probably caused quite a lot of problems with vaccine hesitancy and so on. So I think it would be very encouraging if you could rerun the study now to see what has happened after COVID, and specifically look at comprehension of the packets that you have put together, because I think that would have been a very important follow-up element of your study, and you correctly pointed that out. Okay, we have another comment in the chat, which is from, I apologize for the mispronunciation, Gillian Rust, who says, wonderful work. And the question follows, are there any ideas on including schools in such a study, especially if you're thinking about doing a follow-up?
I think the inclusion of schools will be a really great idea. I wouldn't be opposed to it. I think the more the merrier. I think utilizing the resources is the best way to do it. I mean, again, the study that I used was based on the New York State English achievement test. So I think utilizing schools would be a really key asset.
Thank you very much. Does that answer the question that was posed? Or is there any follow-up comments or clarifications that are required?
Dr. Roman, can I just compliment Shayla? Yes. And then just also mention that this approach is extremely useful, given the fact that 22% of the people spoke languages other than English, and so which means that roughly about a quarter of the population were not actually speaking the language in English, and so they were speaking other languages. And so this is very important in multi-ethnic communities where information has to be reached out, especially if people are also physically challenged, disabled and wheelchair bound or bedridden. Communication becomes extremely critical. So I think we should look at opportunities where this approach could be taken up by teams and by universities and by NGOs and other partners. Thank you.
Thank you. And the paper that I wrote fully explains all of this. It also explains that people aren't just, they're not exclusively in one vulnerable category either. Sometimes people are in various different vulnerable categories, making them that much more in need of their needs to be met that much more. And the theory that I discussed in the paper is disruptive innovation theory, which really is just saying sometimes we need to take the simplicity approach. And that's really what I did without even realizing, and that was just paper in hand. That's what I was doing, because everything we do now is technical, everything is digital, and sometimes paper in hand is just what people need. So yeah. Yes. Thank you.
Okay. There is one more comment in the chat which goes something like this. It is from Susan Park, and it says, thank you for a thoroughly insightful presentation. Okay, thank you very much for your presentation. And ladies and gentlemen, thank you very much for joining us in this session number 5. It is at the moment 3:12 p.m. Central European Time. We will take a break until 25 to 4, which means you have about 23 minutes for tea or coffee, and we will resume after that. Thank you very much.